Good evening. I'll call the Board of Health meeting to order at 6:31 PM. First item on the agenda to please rise for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Item number 2 is to accept the minutes of the April 30th meeting.
I make a motion to accept the minutes of the April 30th meeting.
I will second that. Any other discussion? Hearing none, all in favor? Aye.
Aye.
Passes unanimously. Up next, item number 3 is nail salon regulation discussion. I'll just have you identify yourself and then give you the floor for a little bit.
Okay. My name is Suzanne Stefanik, and I've worked in the field of sterilization for 47 years. And I've got my certification in many areas within sterilization. I'm a certified surgical tech. I'm a certified registered central supply technician. I'm a certified instrument specialist. I'm a certified healthcare leader. I've got a BA, an MBA. I serve on the AMI boards, and I'm a voting member for the FT79, which is for the sterilization guidelines, and then the ST91, which was the guidelines for flexible scopes. I've taught many classes on sterilization. I've taught many classes on high-level disinfection. I'm well-versed in tabletop sterilizers. At one point in time, I was doing the cleaning, disinfecting, and sterilization guidelines for, and documentation, setting the standards, and doing the competencies for 52 clinics, about 189 FTEs. So something piqued my curiosity, and I looked at some of the guidelines that Dudley has put into place, and some of them just, they're not attainable, and they don't follow the FDA and the CDC regulations. Tabletop, any sterilizer is a Class 2 medical device from the FDA, and they have very specific guidelines. And I can give you copies of all of that. There was one that I noticed, it said that it was 270 degrees, 20 pounds of pressure for 30 minutes. That scientifically is not attainable. For 270 degrees, you have to have a pressure that's 30 PSI. And if you're going to go down to 250 degrees, then it's 15 PSI. So it's not, I just want to help you understand when you say to somebody, you need to sterilize, that these are the guidelines that are needed. I think I found it more under the tattoo guidelines. It defines autoclaving, and it says, by the use of an autoclave for a minimum of 30 minutes at 20 pounds of pressure, PSI, at a temperature of 270 degrees Fahrenheit.
Can I ask a question, Mr.?
Certainly.
Do you think it's a typo?
I want to say no, because at 270 degrees, it's 3 to 4 minutes at 30 pounds of pressure. So there would be 2 typos. I can't answer whether that's a typo or not. I didn't.
Where did these regulations come from?
That was the tattoo regulations that you're referring to
Yeah.
at this point? Okay, do you have a copy of the tattoo?
Oh, our tattoo regulation?
Yes.
Oh, I thought we were talking about.
Well, the nail salon, it says, refers to guidelines that is used for meeting the standards of the Dudley Board of Health regulation and guidelines. So I would think that would come under, I'm not sure.
We have no tattoo regulations at this time. Officially, we have no tattoo regulations.
Officially, yes.
Well, it's on the website. That's where I got it.
Is it up on the website? Okay.
It may very well be on the website, but
It has not been, it
That's
was supposed to be
something we're
signed.
looking
it has not been ratified, so it,
Right.
and if you're saying that it's incorrect, we would love to see
Yeah.
what the correct wording is, and we'll edit it.
Yeah. Okay.
If
So,
you've got something that we don't know,
I got a lot of somethings. And I don't mean it that way, but there are different,
well, you know what, I would, very seriously, instead of
you have the FDA.
public meeting and a public hearing,
Share some information.
and taking up a lot of time in a public hearing.
Share some
We
information.
can meet with her in the office with Ms.
Just to
Stefanik.
give you a quick overview, these are the FDA guidelines.
For tattooing, or just
Sterilization.
sterilization in general.
Okay, and they talk about two different types of sterilizer. There's a gravity sterilizer and there is a dynamic air removal sterilizer. And they both have different guidelines and different ranges.
Okay, my point is, we have a commentary on it now, or a potential correction, and what are you suggesting we do?
I'd be more than happy to help do whatever you need to do. I know one place it talks about putting in a little piece of tape to show that it's been sterilized. This doesn't tell you.
Where are you talking about? In the nail or the tattoo?
I'm not sure which one it was in.
Okay,
These are ours. You should. Right here. Oh, you got body arts too, I don't. I didn't get the body arts in mine.
Because you told me you didn't,
Oh, that's right, I remember now, okay.
because we weren't, that wasn't part of what we were
I got
gonna
it,
talk
yep, yep,
about.
I remember now, sorry.
Do you want mine?
No, I'm sharing, I'm good, sorry. So, I guess what I would, Tom, you did a lot of work on our guidelines, you went to other
Yes.
places and everything. What I would think might be helpful, and I don't know, correct me if I'm wrong, is if perhaps you sat down with her and if you could go through where you see something and you could discuss it with her? Is
And
that,
I know you said that you thought that that was a misprint, but as I'm thinking, or a typo, those parameters are out there for a lot of other places. So I don't know who copied from whom, you know,
well, again,
my only thing is that if you're gonna tell people that they have to sterilize, I think you need to understand what's involved with sterilization. I mean, even to the point where how you put your packages in the sterilizer is important. You can't lay them flat on top of one another. They have to be like you put dishes in a dishwasher.
again,
Yeah.
that comes down to technique. And, you know, if there's some technique that has to be written in the code, that's fine. What we do is I know that we went for the autoclaves in the nail salons, which is not mandatory under state law.
Which is or is not?
Excuse me?
It is or it is not?
It is not mandatory. They do cold sterilization, they do liquid sterilization.
What,
I'm just telling you what the state regulations are. There are other communities that have gone steps further. And we tried to go steps further. And again, this is, I really would love to hear the information that you have, but I don't really think this is the forum for it. If you'd like, we can come in
that's fine.
and you can give us an education on what,
That's
on-
fine. I'll be more than happy
on what would be
to do
correct.
that. But I didn't know how to approach it. And when I had talked to people, they said, well, you know, put yourself on the agenda
And
and go from there.
if we have to amend our regulations, we'll
by
be
all
glad to
means.
do it. Just,
Absolutely.
we're
things more
trying to
clear.
move in a direction that
It's safe.
we're on the forefront right now of nail salon regulations. The state is the one that regulates that. We've stepped up and we've gone to a local regulation because we think we can do a little bit better job and more frequently than.
I'd be happy to even teach people in the town of Dudley who have sterilizers. I'd be happy to teach
We're
them how
down
to
to
use it.
one right now, so
You what?
we're down to one facility now,
Oh, okay.
okay?
I'll still teach them. Because I think you need to understand also what you're asking people to do when you ask them to sterilize.
Well,
You know exactly what's
I would
involved.
make myself available for a workshop or anything else that, and Laurie is our nail specialist, that,
Yep, I definitely would be willing to participate in that.
you know, we're open to any information that you've got.
what I think is that if we sit down and go through both sets of regulations, you know, one or two, whoever, with Suzanne and go through and she can tell us where she sees something that doesn't
Absolutely.
quite
The verbiage-
jive.
the verbiage
You know,
might
We're
need to
open,
change.
we're open to
Right.
suggestion, to edit, or correct, or whatever we need to
Exactly.
do.
And then, you know,
The
if,
verbiage needs to be clear.
right, if
For
you wanna,
salon owners, if we're gonna implement this, or we already have.
right,
See, there's a whole process, we'd have to go back and,
This,
the one regulation, the nail salon regulation that we do have, we'd have to, come back to the
Amend.
board, to a public meeting, and then amend the regulations.
That's
We
fine.
can't just change them tonight.
No, and that's not why, I'm not here to tell you to change them tonight. I'm here to offer my services to help you understand what's involved with sterilization.
so would you wanna set up a time? I would have you and
If-
Lori sit down, rather than, cause I don't wanna have the whole board,
Right.
but I'd have you and Lori sit down, to make a time, and then you can bring it back to the board, and we can then go through the process if we wanna make the amendments, do the public hearing, blah, blah, blah.
Absolutely.
The whole
We can-
process.
I'm sure
Very
between the
good
three of us, we
suggestion.
can come up with a common time.
Right, so, how do you wanna, will I have,
Why don't we leave it up to, what's Ms. Stefanik's availability? Do you work during the day, or? do you-
Oh, yes.
So you're available evenings?
Yes, I work in Boston.
You work in Boston? Okay, so,
So my availability depends on the traffic.
understand that?
how about, you know, the thing that would work, how is your schedule on Thursday evenings?
Oh, Thursdays, it's girls' night out, that I won't do.
What's that?
Girls' night out, I don't give
Oh.
that up.
Is there a better night?
Tuesdays, potentially, yeah.
Tuesday?
Tuesday, June 4th.
Tuesday, June 4th?
I'm good with that.
6 o'clock, 7 o'clock?
The
Dinner
later the
meeting?
better, because you have traffic to deal with.
I'm gonna say 6 o'clock, but Tuesdays, usually the worst day driving home is Fridays.
I'm sorry, what?
Usually the worst day driving home is on a Friday. But a lot of schools will be out by then, so.
So that'd be June 4th.
Potentially, or the 28th, like next Tuesday. Do we want to make it that, like,
You want to,
28th?
that's the day after the holiday?
Yeah, is that a
Not a
tough
good
day?
idea.
That's what?
The day
The
after
day
the
after the
holiday.
holiday.
What, Tuesday, June 4th?
No, the 28th.
No, the
We're
28th.
talking about the
28th, no.
Suggesting the 28th.
I'm going to the ballgame.
so Tuesday, June 4th,
June 4th
is this a 6 or 6:30?
Or June 11th, whatever.
at 6 or 6:30? 6:30 better? 7 o'clock?
Can we stick with June 4th, Lori?
Okay, I'll shoot for that, yes. So 6,
6 o'clock, all right?
6 o'clock is fine.
6 PM? Board of Health Office, is that where you're gonna meet?
That's as good a spot as any.
Okay.
Yes.
Ted gave me his phone number, so if I'm late, I'll call him.
That way, no, you guys will, but you can let Tom know.
The Board of Health Office is down the hall on the right, first office on the right.
Right. That way, you guys can go through it and whatever you need.
Open for that, yep. I mean, Mrs. Stefanik showed me how to use my autoclave for my salon, and
Thank you.
I'm assuming those methods are still correct, but nothing is, and if I wasn't shown initially by you how to use my
I'm
autoclave,
sorry.
if I wasn't initially shown by you how to use my autoclave, a lot of that information is very vague. So, you know, I think putting more detail into the regulations on completely how to, you know, what's the proper autoclave, the temperature, the pressure, is very important, the bagging. So I think the more clear we can be in our regs, the better, and
Absolutely.
Again, I don't have, unfortunately, I thought an autoclave was an autoclave was an autoclave, and they all work the same way, and,
But it's changing so fast, people can't keep up.
We'll try to make it as,
yeah.
And the Board of Health shouldn't be a training at the training facility on how to use your autoclave.
I think that's a wonderful suggestion.
I'm sorry,
That's okay. All
I
right,
think I
so,
was talking for Tom.
that's
Yeah.
all right.
You're welcome.
So we'll, you guys will meet on Tuesday, June 4th at 6 PM in the Board of Health office, and then they'll report back to us, and you're, at the next meeting, you're more than welcome to come as well. We can go from there.
Okay.
Thank you very much for your
Thank you.
time.
Thank you.
Thank you.
Okay, moving on, the next one, number 4, it's body art regulation. We will be continuing it to next month regardless, because we don't have a full board tonight, and I don't want to do anything
Exactly. That makes sense.
with that. Up next, number 5 is contract reviews. We won't be doing anything tonight with them as well, because we don't have a full board, but what I will just, we will have the burial agent, we will have the health agents, we have the budget was passed last night, so we'll have his contract ready for the next meeting so that we can, Ted might even try to get it out to you sooner so you can review it for the June meeting. Okay? And then we'll be able to go forward and vote on that, so that as of July 1, you'll have a current contract.
I think some numbers just go down or something.
Yeah, they just go down. Didn't you say you're not in it for the money anyways?
Not
You
here for the
love,
money,
you just
the
love,
fame and the glory that
and
goes
being
along.
with us, right? That's it.
Exactly. Well, if that's all it was, that would be satisfying.
Thank you. And, the animal inspector, we just have to continue to recommend her to the Board of Selectmen because they do through,
It's a mix of the two.
yeah, the ACO and
Our
animal.
animal inspector is actually under the jurisdiction of the Board of Health.
Right,
The animal control officer is the Board of Selectmen. What has to happen there is the Board of Health has to nominate
yes.
the animal inspector. The animal inspector is actually named by Department of
Agriculture?
the state,
Yeah,
Mike Moore.
yeah.
And then it comes back, the actual appointment is made then by the Board of Selectmen.
Board of Selectmen.
All right, so moving on to number 6, the health agent report.
Why don't we start off with B, we'll close that subject right away.
Sure.
Some of the inspections, we're current on all our inspections, all of our activity. We have one open notice of violation that we're going to be addressing through non-criminal disposition. We extended a courtesy 30 days to a property owner that has had runaway metal collection and other activities, and we gave him 30 days to clean it up, and I just did an inspection today and
Saw
has
some
not
improvement?
complied with our
Oh,
agreement.
Okay.
So our next step is now non-criminal disposition, and he'll receive a ticket for $300, and he'll receive a ticket weekly until it's cleaned up.
Excellent.
Thank you.
That's number 1. All the other complaints, I believe, are all addressed. The housing complaints have been remedied down on Jean Street.
Yes.
We're all set down there.
On
our
your end,
side,
yes.
Yeah. And
Then there's
the next homework assignment that I do have, or did have, is vaping.
Yes.
Now, one of the, we've had one individual approach us a year or two ago about vaping facilities, a vape shop, and all of that. I've done some more research on it. We were kind of hoping the state, in actuality, the state and the feds are going to be stepping up with some vaping information and vaping activities. There's an awful lot of literature out there about vaping, both sides. Believe all that you read, but understand that what you read may only be half of the truth. There's, both sides are arguing, and they're taking statements and stuff and some of their findings out of context. Understand that these are only authors' opinions and not professional or scientific information. This is just repeating of data that's been collected, or that somebody has read, and then they're writing it into a different article. Prime example is the medicament, or the suspending or the solvent that's being used in all of the vaping products are propylene glycol or a vegetable glycerin, one or the other. There's advantages and disadvantages to each one. That's the actual product that's making a big cloud. It also has, because it's combusted, it also provides irritation or a little bit of a hit. If you're a smoker, there's a hit that it hits in the throat that it can be satisfying to a smoker, and it's irritating to non-smokers. The truth, the part of the truth is that glycerin, or the vegetable glycerol, is, according to a lot of the companies out there, is a safe product when it's used in food, when it's used as topical preparation, cosmetics, etc. When you ignite it or combust it or atomize it, it becomes a whole different issue. And it's the information they're not telling you, is that with propylene glycol, I believe it is, one of the dangers of tobacco smoking is the amount of formaldehyde coming off of cigarettes. Well, the indication is, according to the literature, there's just as much formaldehyde coming off of combusted glycerin, or the vegetable glycerin, as a cigarette. The good thing about vaping, there are some positive aspects about vaping, and they can be used as an adjunct of smoking cessation. They're great because you can regulate the amount of nicotine, because most of them have nicotine in them. The manufacturers are putting small amounts to larger amounts of nicotine in them. You can either tighter the concentration of the solvent to adjust the amount of nicotine that people are getting, light cigarettes versus heavy cigarettes, unfiltered cigarettes, all of that. You either do it through concentration, or they do it through the electric charge. What they're doing is you can put a heavier electric charge and atomize more and cause more of the nicotine. Nicotine is the actual addicting product that's in cigarettes or in smoking paraphernalia. The things were going along very well with the smoking cessation programs and literature that's out there over the past 15 or 20 years. Smoking has dropped, believe it or not, 67%. The problem we have right now is the flavored vapes, the blunts, all of these that are attracting the teenagers to smoking. It's now, according to a lot of the literature out there, it's in epidemic proportions. A lot of communities, the FDA is looking to regulate. They're going to ban all flavored e-cigarettes. The only thing they're backing off on at this point is the menthol ones, because, again, being used as an adjunct for smoking cessation, they don't want to take the menthol away and drive those people back to smoking menthol cigarettes. But as far as the bubble gum and the mango and the whatever else flavors that are out there, the big attraction is for the teens.
So they're looking to do away.
So what communities are doing is they're regulating, first of all, the sale of e-cigarettes or flavored products. Even the state is considering it. Under 21, they can't sell them to under 21. Other communities like Somerville and Lynn have limited their where they can sell the product. They're taken out. They're no longer allowed in convenience stores, they're no longer allowed in the gas stations, they're no longer self-service. They have to be behind the counter. They can't break up the product, they can't alter the product, they can't, if they come in a manufacturer's form, they can't break it down and sell one cartridge at a time or any of that. They can only be sold in facilities where it's adults-only purchases. Nobody under 21 can go into a place like smoke shops and stuff like that, or tobacco sales shops.
I have a question. I thought I read that there was about 20% of the state that had enforced.
I'm sorry.
About 20% of the state, I had read somewhere, that had started to enforce those regulations. Are they all as strict as some
Well, they're all
of them?
looking into it.
They're looking
There's
into it.
other communities that are, there's some communities that have already started. The Attorney General for the Commonwealth has already started to look at it too. The legislature has looked at it, but they're right now taking a wait-and-see attitude to see what's happening. But based on a lot of the data that's out there, it's not a bad thing to, and what I'll do is I can, to just consider regulating it. There are, if you go and research the laws, I've done a lot of the research on some of the statutes. You would probably have to stretch, but the law prevents the smoking or the inhalation of any foreign substance, period, for its euphoric properties, et cetera, et cetera. That statute came about based on, what do you call it, model glue or airplane glue. That was number one, and then the other products that started to follow were whips, whipped cream cans, because they're loaded with nitrous oxide. So that's why the statute came up with that. If you were to take and stretch more now, with the nicotine, you get, and smoking products, you get a euphoric, potential euphoric effect. You get a physical effect of the chemical and the irritation hitting your lungs and hitting the back of your throat and all of that. So there are a lot of other things to be considered, but it seems as though the Lynn Board of Health and the Somerville Board of Health, they've taken a parallel approach of the products themselves, banning sales in certain products. And one of the communities is also taken up with pricing. There's no longer, you can't go in and buy one blunt. The singles, they have to be in a package of at least two, and they have to be a minimum price of, I don't know, $5 or something like that. They have to make it, they're trying to make it so that it's unaffordable for those types of products. Danger that's coming up with vapes and vaping lounges and vape shops is the prime example of, what was it? I think it was Taunton. It was some community in the Commonwealth.
That's okay.
They were in the vape shop themselves. They were now selling marijuana out of the vape shop illegally.
See,
They didn't have a marijuana permit or any of that. So.
that's one of my fears, is that, if not having things in original packing and things like that, that's what can begin to happen.
The indication is that there are the cartridges available with THC or some cannabinoid, and it seems as though the permissiveness of the THC and marijuana and all is running amok right now. Restaurants are opening it up. They're mixing it in with foods now in public restaurants. It seems as though what it's done is it's changed an attitude. People are brazen about it,
There's billboards up on the highways, that say marijuana is legal now.
but, yeah, I'm digressing down into the
Yeah.
marijuana thing.
Right.
Yep.
The vaping issue is, it's definitely substantial information out there that it's a real danger to teens, and it's an incentive for them to move on and smoke.
Yeah, I
It
definitely.
is certainly not a safe product.
Right, and that's why I really want to make sure that, I'm not looking to put anybody out of business or anything like that, but personally, I think there needs to be the restrictions of the behind the counter. It's not just walk in, you can't break things up, they have to be in original packaging, then you have less chance of tampering.
It's the same, Jen, it's the same companies that are out there that have lost a substantial amount of their market for tobacco sales, that are out there marketing these e-cigarettes.
Right.
It's a substitute for and this is money. It's pure money and nothing more than money.
Right.
They're trying to hook people.
And that's why I think it's worth putting
Most
some
definitely.
restrictions
think,
in
you know,
place to protect our
At
youth.
some point, you want to consider doing whatever you need to do to help people and protect people from themselves. It's not a bad thing.
No.
Good point, that's a very good
Um,
point.
We do it all the time. There's an awful lot of things that we do to protect people from themselves.
So do you think that you can I know you've pull together high points of some regulations that we can go over and look at trying to mush and,
What I can do is, I can give Ted the two regulations, the city regulations, that I've taken out, that I downloaded from the computer. One is the city of Lynn, the other is the city of Somerville.
okay,
And they're parallel, and they've got my concern about bouncing information around and all, you need to have references and all of that to go with it. You can't just
right.
grasp information and pick it out of the air and put it in and say that it's true.
No, I
So, I'll have Ted make make copies of these
agree. Yeah,
for everybody, as well as some of the other indication of, there's the article on the FDA, the limited sale of sweet-flavored e-cigarettes in hope of curbing the teen vaping epidemic. There's the copy of some excerpts from the Massachusetts e-cigarette regulations and why they're trying to do it to control access and eliminate or minimize teen exposure to them.
okay,
And then probably one of the chemistry article is for the propylene glycol and the vegetable glycerin. Again, what you'll find is the article is true, but there's a lot of missing information.
so
And
I'm sorry.
The further you get into it, the more you'll have to do some more reading. There's nobody that's coming out, and I won't say there's nobody. There's an awful lot of stuff that's coming out, but
Which-
nobody's stepped up to the plate 100% yet. Not many have stepped up. I would love to see, like I said, with tobacco control and all of that, the state step up.
Right.
And now I'm glad to see the feds are stepping up too. The FDA is stepping up.
What impressed you the most about Somerville and Lynn's, what they've done,
What impressed me about them, as far as,
like their regulations that they
Oh,
put in place?
the
Like,
thing that impressed me the most was that not only were they regulating, limiting the sale, but they were regulating where they could be sold.
okay,
how they addressed everything from, they can't discount the prices on the products, legal sales, there's no more roll your own, all those roll your own tobacco products
Right.
gone.
That's good.
Retail stores, they describe what a retail store is, what a self-serve display is, schools, and what a smoke constituent is, what constitutes smoke and all of that. They've defined everything.
That's nice.
Smoking bars, tobacco products, if marijuana spills over into those, the smoking in the workplace, which is, basically, it's all secondhand smoke. The thing about, one of the positive, or an indication of the positive aspect of vaping is that minimal or limited secondhand exposure, although I don't believe it in 100%, because if I can smell it, it's vaporized. It's atomized or it's vaporized. And in a case like this where they have battery-operated packets and all that, those are vaporized. They're combusting the product through an electric charge and all that. An atomizer is more like your inhalers where you have the pump,
Right.
it's got a propellant in it.
So, what I would like, if everybody agrees, is that Ted will get us copies of everything, we can review it all, and next month come, and like we did with the marijuana regulations, we had some brainstorming meetings where we would sit down, review the regulations, pick what you like, what highlights you really enjoy from both. We sit down and we try to either follow suit, like we just happened to, with the marijuana,
Probably
we
the
went.
easiest thing to do is to go through the regulations for a couple of communities.
Right,
And take a highlighter, and we'll go through it page
Yeah.
by page. What you like, what you don't like.
yeah.
It appears as though they're parallel, these two communities. When somebody stepped up to the plate.
Now, do we, just curiously, do we know, are any of the towns around us do anything? I haven't heard anything. I know, doesning Oxford have a vape shop?
They have a vape shop.
And Webster does too.
What I did do, on one of my sources, I'm trying to inquire, about vape shops and about, smoking, cigar bars, we call them, or smoking bars. How that works and how you can regulate those.
That would be good too, to
That would be,
have additional information.
That's more info from other
I'm sorry, I
towns.
just don't want to see something parallel to a hookah bar.
No, not especially because there's, like you said, we have the marijuana now, and you don't know,
When is it going to spill over?
right, what goes on behind the closed doors, kinda.
And we have a college.
Yeah, we do.
We need to think about that.
Well, we have an audience
Mm-hmm,
in place, but
right,
we actually have set a couple of audiences, even the high school.
Mm-hmm.
very true.
The high school, and now we're finding out even grammar school, middle school.
Yeah, no, I think that would be good. If you can let us know, just shoot out an email when, I would prefer a hard copy, not an email of them. I like paper, so, sorry.
It's easier than carrying your laptop around to try
Well,
to read it.
I like to make notes and stuff, so,
Right.
Right, you want to highlight,
yes, I do.
I caught that point.
Thank you.
You're welcome.
So just let us
So
know when
I'll
you're
give
ready.
those to you.
Okay.
You can let me,
Madam Secretary, is that what you
yeah,
want?
Madam
Madam Secretary.
Secretary.
Hard copies are good, and highlighters are good.
Yes, and just let us know, let them know. You can let me know anytime when they're ready.
Or if you want to take a copy with you, I'll just go make it.
You
Okay.
get special
Wow.
treatment, wow.
This thing
Throw a
have to
pen at me,
come back.
so.
Yeah, he did, so, okay, you're making up for the pen. All right, thank
That
you
would
on
be
that.
lovely, thank
That's
And-
very good, Tom.
One of the
Wow.
things, I think, not only just run with regulations or any of that, I think we should make sure that we let other boards know that
Mm-hmm,
that we're going to be regulating or we're going to make an attempt and get some feedback from
Right,
other boards as well, including the Board of Selectmen, Planning Board,
yes,
if they have any comments or anything like that, by all means.
absolutely.
Um,
Should we send them an email right now that we're starting to work on it, if they have any input?
If they have any concerns or comments at this point,
Okay.
before we get
Early
rolling
on.
full tilt,
Right.
let us know which direction you want to go, because right now, we're starting off at a clean slate. The other one we probably should do is either the superintendent of schools or the school committee.
Probably school committee.
Yeah,
Because now I see through the city of Worcester, I believe it's the city of Worcester, I read an article where they're choosing not to enforce the zero tolerance on smoking or vaping in the high school or in the schools. At this point, they figure that, I mean, they've got enough other,
bigger fish to fry.
yeah, they got bigger fish to fry right now, but,
Yeah, so Ted, would you send out an email to Selectmen, Planning Board? I think.
sometimes it's a
And
matter of
school committee.
you can write regulation, but if they're not gonna enforce it somewhere,
Right,
what good does it do?
I agree. Excellent.
Okay.
Thank you.
That's
Anything else
excellent.
from you?
That's all I have today.
Okay, I have just a couple things. Just as an FYI, if anybody's watching and has been trying to get in touch with the Board of Health or any office in the town of Dudley, the voicemail system is down right now, so when you do call, it just rings and rings and rings and rings. And if you did leave a voicemail over the weekend, it's probably still there, because we have not been able to check our voicemails since last week. They are aware of the problem, and we've received a ticket number that they're going to be working on it. So just as an FYI,
So call again.
email,
Well, it's either that or
Email.
we can have them email
Email's
yeah.
it to us.
You can email at boh@dudleyma.gov. So just as an FYI, and anybody who's listening, trying to reach anybody, that's what's going on. And I don't think I have anything else. The next Board of Health meeting will be on Tuesday, June 18th at 6:30. So, anybody have anything else?
I'm good.
All right, seeing that, I'll entertain a motion.
I make a motion to adjourn tonight's meeting.
I will second that. I have a motion and a second. Any other discussion? Hearing none, all in favor? Aye. Passes unanimously. Meeting adjourned at 7:13 PM.